How to talk about suicidal feelings. Serious topic, and how to talk to your child about suicidal feelings can be a very uncomfortable conversation and a difficult one for most parents. The first suggestion that I would give to parents is that they do not shy away from the topic. They don't sugarcoat it. They don't try and make it comfortable. They just need to come out and talk about it. And you need to use the right words when discussing suicide. So talking about things, and sometimes parents will communicate with their children and talk about, oh, do you want to hurt yourself? Do you want to harm yourself? Thinking that they've actually talked about suicide. No, you need to come out and use the right words, black and white, so there's no question about what you're discussing and what you're talking about. So that's the first recommendation. Use the words that you mean and mean the words that you're using. So be very specific and come out and say, have you thought about suicide? Is that something that you have considered? The other thing that I would recommend is that parents learn to turn off their emotional responses to whatever the conversation is going to be. And turning off your emotional responses is a very difficult thing and actually requires some self-control on your part. But the idea here is that you're trying to draw out more information from your child in a way that is not threatening and where they are overprotective about information. If they feel you're going to react emotionally and question everything that they do, they will not talk to you honestly. And what that looks like is, have you thought about killing yourself, or have you thought about suicide? And then your child saying, well, yes. And then having somebody go, why would you do that? You have everything and you're just so great. And but okay, that is the opposite. That's an emotional response. The correct way would be to say, okay, so you've had these thoughts. Tell me more. You're actually trying to invite more conversation, and you're trying to get more information as you continue to talk about these issues. Now, you want to continue to have conversations with your child about this. If they've ever expressed any type of suicidal thoughts or tendencies, you want to seek out some professional help as well for your child. And this could be in the form of a therapist, a pastor, a teacher. You want to find some additional support to help your child in dealing with these things. Another thing that you can do as a parent is to determine whether or not these feelings or these thoughts are coming from an external source or from an internal source. So external would be like, is bullying occurring? Is something happening at school or on social media that's pressuring my child to feel like suicide is an option or the key? Months ago, there was a TV series, a Netflix series about suicide, which in a way glamorized suicide, and that led to some children wanting to commit suicide. So is it an external thing that's happening with your child, or is it something that's internal, like depression? Does your child suffer from depression, where everything could be going great on the outside, but inside they feel low, they feel like they're not in control, and that it's an internal struggle? Once you can determine these two things, you can start to address the issue that is happening. So the recommendations for parents is to begin the communication by being very blunt, being very honest, and using the right words, and being very specific about what it is you're trying to talk about. And then the next thing is to be able to continue the conversation without responding emotionally to what your child is saying, in order to draw out more information from them. And finally, finding whether or not what is causing these feelings is external and something that needs to be addressed outside, or if it's internal and it's some type of mental issue that they're dealing with, depression, anxiety, or something else that's happening. And actually, in determining those two, they can blend. There can be a blending of the two, but trying to determine, okay, what is causing these feelings to happen will be super important in the treatment of your child and in helping you as a parent help your child. So again, don't shy away from the topic. You need to be very forward and very honest about it. Keep the communication going. And if you struggle with controlling your emotional responses, really take some time to evaluate how you're going to approach this topic with your child. So those are the recommendations that we would give. Now, what behaviors should you as a parent notice in your child in the first place is, again, you should be looking for a change in behavior or mood in your child that is not consistent with their overall personality. So you're going to look for changes that may occur, and you may it's different for a lot of different people in the way that they manifest. So you can see signs of oversleeping or overeating or oversensitive, for example, over a period of time. And then sometimes when children make a decision to commit suicide, they make decisions that are ways of saying goodbye to the world. They'll give away things that are important to them. They may actually say goodbye or leave letters to people that are more than they usually do. So it's a little more than just what is normal for their behavior. So you're looking for fluctuations in their behavior over time, and a child may actually just come out and say it to you. You know, I've had feelings of suicide, or I'm struggling. Pay attention to communication, body language, and also what's happening in your child's life. If there are things happening in their child's life that are frustrating and difficult, if they're avoiding things that previously they were okay with, if they don't want to go to school anymore for some reason, they're not sick, or if they're making themselves sick so they can avoid things, those are things. So look for behaviors that are inconsistent with their personality over time, and then be aware of other signs that they may be over happy once they made a decision to commit suicide. They may be like too happy and too friendly and saying goodbye to everybody and giving away important things that belong to them. And, you know, just be very, very vigilant about those things and get professional help. Especially with suicide, you want to get some professional help. You want to get as many people involved as needed in order to help your child deal with these feelings and these emotions. There's medication, there's physicians, there's therapy that can help. And so keep the communication open and discuss it openly. I recommend also is that most states have a hotline, and there is a national hotline here in the United States for children who may be feeling that. In Utah, where we're located, there's an app available where they can contact a mental health professional and contact them there and get some additional help there. If you're a parent, you can also use the app and get some additional resources that are available for you. But feel free to look and see what's online, what's available in your area, and also internationally to help with suicide, because it is an issue and it is a problem in our world, and we definitely want to reach out and help kids who may need it. All right. These are the suggestions we have here. For more information, visit the Smarter Parenting website. Feel free to leave comments below and give us suggestions as well of things that you have noticed or that you've experienced or done in helping to prevent suicide among teenagers. And you can contact us on our website as well as leaving a comment below on our YouTube channel. All right. That's it for me, and we'll see you again next week.